Good day, my name is Anoosha Kishore, and today I'll be presenting my SEAL research project titled The Benefits, Challenges, and Sustainability of Healthcare Outcomes Associated with Short-Term Global Surgical Clinics in Low and Middle Income Countries, a narrative review, and my advisor is Dr. Satish Vitesi. Approximately 5 billion people worldwide lack access to safe, affordable surgical services, and a great portion of that burden falls upon low and middle income countries. In response to the global disparity in access to surgical care, short-term global surgical clinics have emerged. These clinics provide immediate life-saving interventions, and they can address urgent surgical needs such as traumas, malignancies, and congenital anomalies. However, the sustainability of these clinics is contingent upon their integration with local healthcare infrastructure, ethical engagement, and long-term partnerships. The narrative review I conducted synthesizes findings from peer-reviewed articles and studies to examine the benefits, challenges, and sustainability associated with short-term surgical clinics in low-middle income countries. This is a map from World Bank to show us an idea of how classification occurs based on income, and we're focusing on the purple countries, which are our low and middle income countries. The social ecological model is a framework that has multiple levels as shown in this slide, and it's a conceptualization of health that includes intrapersonal, interpersonal, organizational, community, and public policy factors. Applying SEM to this narrative review allows us a comprehensive assessment of how the clinics function within healthcare systems and whether they contribute to sustainable improvements. So on an individual level, the clinics do improve health outcomes by addressing immediate and essential surgical needs. However, there is a concern and potential downfall concerning the lack of continued services and follow-up care. At an interpersonal level, the clinics influence local healthcare providers by introducing training and surgical techniques, and they increase the capacity to care for local populations. However, the potential downfall here is a lack of integration with the local healthcare structures, and that can cause a potential for disrupting their system. At the organizational and community levels, inadequate infrastructure, reliance on external funding and resources, and cultural misalignment can compromise the long-term sustainability. At a policy level, government regulations, funding, and long-term partnerships heavily determine success of these clinics. Regarding immediate clinical impacts and benefits, these clinics reduce surgical waiting lists by 20 to 30% in low and middle income countries, and this effectively alleviates the immediate healthcare pressures, mainly regarding acute and manageable conditions where time is of the essence. Global surgical missions have previously contributed to a 12% increase in surgical volume in low-middle income countries over 5 years when they're integrated with local training programs. But it is very important to emphasize the integration with the local training programs for this to be effective. These clinics are also very essential during public health crises, for example, natural disasters, because low-middle income countries are often ill-equipped to address some of their population's emergent needs. So having visiting teams that have more experience, skills training, resources, they can really fill those critical care gaps and reduce mortality. However, it is temporary, but for the purpose of these natural disasters and public health crises, it is very, very essential and effective. Specialized teams also come with these groups, and they're often capable of handling complex cases that are otherwise unmanageable in resource-poor settings of the low-middle income countries. And the clinics also promote health education and prevention initiatives in low-middle income countries while exposing the local healthcare providers to advanced surgical techniques. There are some challenges, specifically ethical challenges and cultural sensitivity concerns. In nearly 40% of cases, there's a lack of cultural sensitivity and preparation that has led to unintended negative consequences, which can include negative follow-up experiences or inadequate follow-up. Ethical challenges such as language barriers and culturally inappropriate care models are often occurring, but those can be addressed with hiring local translators, utilizing pre-established patient consent frameworks, and ensuring local providers are involved in care delivery. It's very important to emphasize the integration here as well, because we want the international visiting teams and the local provider teams to really collaborate, because that creates a very patient-centered view and approach. Aligning visiting healthcare teams with the local infrastructure has proven to increase follow-up rates by 30%, and that reduces complications and improves long-term outcomes. Effective partnership options may include collaborations with international NGOs and local universities to provide structured, ongoing medical education beyond the time period of the visiting teams. Sustainability and long-term healthcare outcomes are an area of concern as well. Partnerships that focus on skill development have increased the self-sufficiency of local healthcare systems, and that's resulted in the 15% growth in surgical capacity over 5 years. It's really important that we focus more on moving from the surgical safari mindset to more educational models because we really want to prioritize the transfer of knowledge and skills from short-term care with the visiting teams to long-term care with the local providers. And we really want to enhance the local health infrastructure. Inconsistent quality of care due to varying skills and experience levels is also a concern just because volunteer staff from visiting groups may have varying levels of experience and the resources they provide are short-term. Surgical training and education to ensure sustainable management practices rather than depending solely on the short-term interventions with limited opportunities for long-term health maintenance is very important as well. Financial and resource allocation is a big area of concern because obviously being able to provide these clinics, there's a cost. So without the consistent financial support, the clinics can struggle to maintain their equipment and resources, and that may lead to diminished quality of care over time. High operational costs may not always justify their short-term benefits, especially if the host country has no framework for sustained healthcare improvements. So we want to shift funds toward infrastructure development because developing local surgical centers and really strengthening the host country's local healthcare system and their infrastructure has shown a 50% increase in postoperative patient retention, and that really improves long-term surgical outcomes. This is a table that just summarizes the last few slides where we discussed benefits, challenges, and sustainability, and just a more concise view. This is a flowchart that outlines a typical patient's journey in a short-term surgical mission experience. It starts with the patients arriving, they get screened, evaluated, they have their surgery, and then they have about 1 to 2 days of postoperative care. Now, after this is where the concerns become pretty concerning, a big deal because the follow-up care is often lacking. So at this point, after the visiting team has left and the skills have also left oftentimes, the knowledge has left, the concern for the patient and follow-up care is no longer there, whether it's from a patient perspective or a healthcare provider perspective, there's an increased risk of complication with this. And so it's really important that we take this to consideration because we really want local providers to be educated on what happens next, what exactly did they do in the surgery, and what are the next steps, and how can they provide for their local population beyond the visiting team's presence. So measuring the impacts of the surgical missions is mainly a result of statistical evidence that we found. And for me, the narrative review, I've looked through multiple peer-reviewed journals and articles. So postoperative complication rates, patient-reported satisfaction, and long-term healthcare accessibility have given us information. 40% of missions actually track patients' outcomes beyond 2 months post-surgery, but there's a difference between tracking outcomes and providing follow-up care. So although 40% might seem like a big number, especially when we're talking about other factors like 15% increase in growth and surgical capacity, it's really important that, yes, we continue to track these outcomes, but we really need to follow up with the patients as well and make sure that their care is actually there. Countries that integrate with local partnerships had a 30% higher follow-up rate when compared to regions that solely relied on short-term missions without post-op follow-up care. So in the future, it's really important to consider all the things we discuss in terms of benefits, challenges, and sustainability, as well as the financial aspect of sustainability. So investigating cost-effective models to integrate the clinics into local health systems could provide valuable insights for policy development. Mandating local collaborations and establishing follow-up protocols is also very important because we really want to emphasize the collaboration, maintaining financial stability and shifting the funds toward long-term infrastructure development to benefit both patients and providers and from the healthcare system perspective, examining strategies to foster trust and effective collaboration between both international and local providers. This can occur with cultural competency trainings before visiting countries because it's very important to understand what the potential barriers are. We also want to consider comparative studies to analyze outcomes of short-term and long-term intervention models just to give us more evidence-based recommendations. And then integrating a possibility of mobile health technology that can allow local and international healthcare teams to collect and monitor patient data that can also give us more evidence-based intervention. So in conclusion, these clinics are great and they provide great resources, but we do have concerns for sustainability, funding, ethical and cultural concepts as well. And so we want to apply the social ecological model so that we can evolve from temporary relief to lasting sustainable healthcare improvements. These are my references. And thank you very much.